Hey everybody, sorry for the delay. I had a patient, a little emergency I had to take care of. Really apologize for being late. Part of the problem about having this at lunchtime is schedules get a little bit overlapped. One person's a little bit late in the morning, and then by the time lunch comes, I'm pushed and pushed and pushed. So I wanted to jump on today and answer any questions regarding BFR that I can answer. If there's anything specific, please go into the chat section. And I'm just going to say hello from Dallas. And just send that in and let me know if there are any questions that I can answer. BFR increased pressure beyond the occluded limb anywhere else in the body. So besides the occluded limb, does it increase pressure? That's a good question. Well, it doesn't increase limb occlusion pressure that I know of. It does. So cardiac output, I'm going to put this in the notes. Cardiac output is equal to heart rate, how many beats per minute, times stroke volume. Cardiac output is the amount of blood that's leaving the heart and going to the periphery. So if I got a cuff on, clearly this is not the right cuff. If I've got a cuff on, remember, blood flow is restricted from leaving the limb. So in the upper extremity, we use 50% limb occlusion pressure, right? So only about 50% of flow is going in, but I'm still getting blood flow in. There is zero venous return. Because the veins are more superficial, I am occluding the veins. Think about when you give blood or you get an IV. I put a tourniquet on your limb. That rubber tourniquet is not occluding arterial flow. What it's doing is it's blocking venous return. And that's why your veins start to pop out, and then I can insert the catheter. So that fluid starts to build up down in here. Well, if the fluid is here and can't get back into the system, what has to happen is that my heart rate has to go up in order to still create the same cardiac output. So if stroke volume goes down, heart rate has to go up in order to maintain the same cardiac output. Because you have a decrease in stroke volume, my guess would be, this is purely a guess, that your blood pressure would go up a touch because your heart's going to have to work harder to push the same amount of blood, and it's going to have to work faster. So you're going to have to increase the heart rate and increase the ejection pressure of the heart. So I guess to answer your question, Lewis, I would say probably. It doesn't exceed high intensity exercise. So, I'm not worried about it from a safety standpoint, but I would say, yeah, it probably does, but probably pretty insignificant. Any other questions? Where's everybody from today? Where are you guys all at? Rainy and cold New Jersey. I don't know if I told you this, Lewis. You're here every week, so thank you so much. I lived in central Jersey, central North Jersey, in a little town called Basking Ridge. My dad was with AT&T, and I love Jersey. Most people out here don't understand why they call it the Garden State, or they don't think about it, but Man, Central Jersey was so beautiful. So much green. Yeah, we had this big acre and it was wonderful. No fences, awesome neighbors. We used to just run around like crazy, like little animals. How about anybody else? No? Does anybody else have any other questions? I don't really have anything. I don't really have anything planned. I've been pretty slammed with the clinic. So I just wanted to get on, answer any questions that anybody had. Happy to do so. If you don't have any questions, I'm going to cut out early today so I can get some lunch and then get back to patient care. But I will be back next week. Been playing around with the new cuffs. And they're looking really, really good. So post-surgery, there's no additional bleeding risk. Minor surgery and after exercise is warranted. Well, so even without BFR, post-orthopedic limb surgery, there's a 100% increased risk in deep vein thrombosis. So your risk already goes up just from having the tourniquet on the limb. And the longer that the tourniquet's on the limb, the more risk you have. So I wouldn't say there's not an increased risk. I would say that there's always a risk with everything that we do. And we just have to mitigate that risk, that there's no pre-existing problem prior. So I'll give you an example. Had a patient that is a football player at Stanford University in Palo Alto, broke his ankle and had to have surgery and had a syndosmotic injury. So they put a screw right in between the tib fib. And he, after 2 weeks, developed a clot. And here's a young, healthy individual. But because of the stasis of that surgery and how long they were under the tourniquet, he developed a clot. So it happens. I mean, there's a risk associated with it. So, really, as long as there's no increased hematocrit levels, there's no previous history of clotting. Post-surgically, the only thing that I worry about is the size of the scar. So if the scar is larger than 2 inches, so if there's a large scar, like if you look at my ACL scar and it's like this long, I would wait until that scar is completely healed before I use BFR anywhere on the body. If the scar is 2 inches or less, I don't worry about it. And the reason is because of the myostatin downregulation. Myostatin appears to be downregulated with BFR, and myostatin is part of scar tissue formation. And so by downregulating, we don't get as much scar tissue and it's harder for that healing to occur. So scars larger than 2 inches, wait until that surgical site is totally finished. Less than 2 inches, don't worry about it. And then something like a minor prostate surgery, they probably did it laparoscopically. No, don't worry about it. It's all fine. No increased risk. Just make sure that they have no other pre-existing conditions. You got it. All right, my friends, thank you so much for joining. I hope to see you next week, where I promise I'll be on time. And yeah, appreciate your support. If you're seeing this on YouTube, please go down, subscribe, and like, and get alerts for when each new session come out. Bye for now.